Welcome. I'm Julie Thompson, Executive Director of PACTV, and today we're hosting the forum for the town of Pembroke COVID-19 update. There's two ways you can watch this on PACTV, live on channel 15 Comcast, or you can go to PACTV's website, www.pactv.org/live, and you can see this live via our website. Also, times for replays of this particular episode will be listed on our website later today. We have set up an email for you to call in for questions. If you have questions at any time during this forum or even afterwards, and we'll forward them to the panelists for next time. That's pembrokeinfo@pactv.org. Again, any questions you have, email to pembrokeinfo@pactv.org. Right now, I'm going to turn this over to Sabrina Chilcott, who is the Assistant Town Manager, and she will host the forum from here. Welcome, Sabrina.
Thank you, Julie. Thank you very much. In Pembroke, the residents are very active and concerned, and they are going to have an update Tuesdays and Thursdays on what the town and its emergency management team is doing behind the scenes every day to ensure their safety and to make sure that all of the Pembroke infrastructure, business, economics, and all of the things that concern Pembroke residents the most have continuity and have an entire group of professionals that are addressing their needs daily. So today on the forum, Pembroke is bringing forward from the emergency management team, Health Agent Lisa Cullity.
Hello.
Hi, Lisa. Lieutenant Rick MacDonald from the Pembroke Police Department.
Good morning.
And Deputy Chief McCormick from the Pembroke Fire Department. Again. So to start everything off, Health Agent Lisa Cullity spends her days working around the clock and bringing all of the best information back to the team where the decisions are made in a roundtable meeting every morning. Lisa, can you talk about that a little bit?
Sure. So yesterday we had one of a series of calls we're having with the Department of Public Health, where the Department of Public Health is going over with all local health departments our current status, our current numbers, things we can expect to see in the upcoming. If there's any new directives, they try to go over those. This week's conversation was very typical. It was more by the numbers. We're starting to see those rapid escalation of numbers that we expected to see. Hospitals are keeping up currently with the number of patients they're seeing, but the surge, the high surge, we're just before that.
Very good, Lisa. As far as your anticipation of the upcoming days, particularly as it refers to the most recent directives from the governor regarding essential businesses, closure of non-essential government operations and businesses.
Mm-hmm. Yep.
What kinds of feedback are you getting from the local business community and from the residents regarding how government is handling the closures?
Sure. So most of the feedback I've had has been really positive. Those businesses that were on the bubble or the borderline were actually happy to have an official order to close. It took a lot of pressure off them. It allowed them to release staff to go seek out benefits elsewhere. A lot of them had already reported back to me they had such a sharp decline in business that was already creating an issue where they were going to have to do something voluntarily either way. There's a small segment of businesses where there's some more pushback. They would really rather be open, but of the calls I'm currently fielding, I'm going to say that's 10%, 90% are happy with the order, happy to comply, happy to kind of, if you would, have the pressure taken off.
That's obviously the desired outcome. Now, Lieutenant MacDonald, when you have a situation where you have a report, I know, is there a protocol, or how is the department handling some of the feedback on businesses?
Well, how it's felt in the past is Lisa would reach out to us because initially they weren't cooperating. So it starts out with a warning, and then the second offense may result into a civil citation to a fine up to $300. And then further offenses will be subject to criminal penalties, depending on the infraction and the complete loss of the license to operate in the town of Pembroke.
Thank you. Lisa, as far as some of the things that we've noticed as needs for the town in the days to come, things are very quiet now. That's a very positive outcome from the Stay Healthy, Stay Home campaign that's being run right now. Do you see additional needs And how have you communicated with the deputy chief?
Sure. So absolutely, there's going to be more needs. I think it's very easy to look at the statistics, even though we're seeing the climb now, and say, "Oh, this isn't that bad." And rest assured, it is that bad. And if you're not sure if it's going to be that bad, take a look at New York City. The worst is still yet to come. This does not mean we panic. This does not mean we have cause to panic. It means we have cause to be more prepared. Don't let the numbers fool you and think, oh, okay, we can relax everything. As far as needs coming forward, obviously PPE for our first responders is a huge concern. Making sure that our hospitals are getting the necessary PPE so that they can treat people is an enormous concern. Taking care of the vulnerable population, which our food pantry in town, the Firehouse Food Pantry, is doing an amazing job working with both schools and private vendors to make sure that food keeps flowing. A fantastic contribution of $5,000 from the Pembroke Chamber has funded them well so that there's going to be food available. The biggest thing people can do is obviously stay at home. Heed the warnings. This isn't over. It's not going to be over for a while. I think the governor made that very clear when he closed schools until May 4th, which I know that was just done. So there's going to be a lot more information forthcoming about that and additional schooling and remote learning opportunities. And if people need that information, hop over to the Town of Pembroke website. That's being updated constantly. Click on that fantastic red banner that links you to all things COVID as it gets updated on the town website. And I'm confident, people have to remember this just happened to a lot of superintendents of schools and school districts yesterday. Give them a little time to digest the information, give them a little time to meet with the Department of Education and come up with a strategy. And I'm confident that once all that occurs, that more information will be forthcoming. It's the same thing with the public health side. This is still emerging infectious disease. Not everything is known about it. So a lot of the waters we're treading into are really uncharted. So the biggest thing we can do right now is be prepared as we can, get out the PPE for our first responders. Everyone stay home and stay well. Don't go rushing to help clinics. Matter of fact, a lot of them are closing. Don't go rushing down to the hospital. You could inadvertently expose yourself. Call your primary care. Follow those instructions. I cannot stress that enough. Don't put yourself or your family at risk by settling on a course of action that may or may not be the right one.
All right, thank you for mentioning the website. One of the things that the team has put together is the really robust one-pager. That appears when you go to the front page of the website. There's a red banner that says urgent alert. And when anyone clicks on that red banner, it launches the one-pager that took into consideration all of the bullet points discussed every morning by the team. The emergency management team wanted to make sure that the town was updated and had what are essential businesses, what is open, what does this mean to you? Every morning it's updated, or actually around noontime after the 10 o'clock debrief has occurred. But now, for example, today on the website, you will see that there's the Wednesday update, or the Thursday update, will reflect the change to the school system. As you pointed out, schools will now be closed through May 4th. So every day residents go to this one pager and they see the updates from the state, from the town, from the fire chief, from the police chief, from the lieutenants and deputy chief, and all of the good information that people can literally click on a link and be brought to the source information. But as far as the point you raised a moment ago,
Sure.
Pembroke's in need of PPEs, personal protective equipment. Is that correct?
Yeah.
All right.
Yes.
So the indication right now is anyone who can help should bring it forward to protect first responders. And Deputy Chief, we're having folks bring them to the Center Fire Station. Is that correct?
Yeah, since we put out that email to get some PPE brought in to see if businesses in the community would donate or give to, we've got a good response. As it stands now, we have enough that the general public have brought in. Myself and the chief have put in a request to the state through OEMS to get another stockpile. So I think we're in good shape as long as this curve stays the way it is. If it gets a little bit worse, which the indications are that it may, we may need a little bit more. But as it stands now, we're in pretty good shape.
Very good. Lisa, as far as some of the things that Pembrokean people in their own homes can do, we've talked about things like staying home, staying safe, but they have to go. Everyone needs occasionally to go to the grocery store.
Sure.
To go out for gasoline, or to make those quick trips to the pharmacy, What are some of the best practices that people can actually follow to stay as safe as they can?
Sure. It's going to vary person to person on based on their needs and their own personal behavior. But I'll give some examples of the things I'm doing to try to keep myself safe. And by all means, use them all. First of all, before I go out shopping, getting gasoline, or anything else I might do, the first thing I do is wash my hands. I've said that 1,000 times, and I'll say it 1,000 times more. Wash your hands. Then I prepare to go out. I take care of my business, and I'm making a conscious effort to touch as few things as possible. So what it means by that, instead of picking up things and reading labels and comparing packages of chicken, I kind of look with my eyes, not with my hands. I make a selection and I stick with my selection, so that I'm not inadvertently touching other things that, anything more than I have to that people might have touched before me. And I'm certainly not touching other things that people will touch behind me. One thing that's really nice is Stop and Shop has a fantastic system. If you're familiar with technology and you like using it, you can get a little shopping gun. So I will often have a Lysol wipe or something else with me. And you can pull them out at the beginning of the store. There's usually a little bin that you can pull out these pop-up wipes. You can wipe your carriage. You can wipe your shopping gun. You scan your Stop and Shop card. You can scan all your purchases. There's usually bags, and I'll get to the bags in 1 second. There's usually bags you can pick up right where you pick up the guns, usually paper, and you can go ahead and put your groceries in that, and scanning them as you go. And then when you go to checkout, this is really cool. If you have a smartphone and smart technology, but you can do it with a card too. You go right to checkout, it scans your gun, your whole order pops up. You haven't touched anything. Keep in mind, this is all airless. This is all scanning. You put your little gun away. You then can take out your smartphone, and if you have pay by smartphone, you can go up to the keypad, and it'll actually take it right off your phone. It'll make a blipping noise, and your payment's all done without touching anything, which is really cool. So I've touched nothing in theory other than my groceries, a carriage, and one gun. That's really minimizing my points of contact. So I love that. I'm a big fan of that. So getting back to the bags, obviously the governor made some announcements yesterday that'll affect reusable bags. Breaks my heart because I'm an environmentalist at heart, and I love my reusable bags. But for the folks that are like me that love them, now's the time to leave them at home. There is a concern for cross contamination. There is a concern when you bring your bags to a store, if you are having employees assist you, either bagging or ringing, that they could touch your bags and inadvertently pick up the virus from you. So we don't want that. We don't want any points, unnecessary points of cross contamination. So unfortunately, now is not the time for your recyclable bags. Now's the time for those single-use bags that are in the store that are brand new and largely untouched. The governor did also release all the cities and towns from the plastic bag ban temporarily to help meet this crisis. So I don't know if our local vendors are going to bring back plastic bags or just use the paper bags they currently have. But just a note to the people at home, now's not the time to bring your reusable bags with you. Gas stations are another excellent point. So if I'm going to get gasoline, I will wash my hands. I will get my gasoline. I keep some wipes and some sanitation in my truck. Obviously, that'll run out at some point. But again, before I go get gasoline, I wash my hands. After I get gasoline, I wash my hands. I wipe down my truck periodically. If you do have Lysol, I know that's hard to get these days, but if you have it, periodically spraying your home, your workstation, your truck is always a good idea. So basically what it is for me is I've gotten, if people actually were teasing me a little bit in the grocery store, you'll see me walking around with my hands in my pockets or my sleeve over my hands. And that's done very intentionally to remind myself not to touch things, because it's really easy to forget that. It's really easy to touch your face or scratch an itch or something like that. So I've begun pulling my sleeves over my hands, or like I said, keeping my hands in my pockets to remind myself as a constant reminder, touch as few things as absolutely necessary.
Thank you. Deputy Chief, what are some of the other things people can do as they're moving around and moving through Pembroke to keep themselves as, isolated, not isolated necessarily, but as away from contributing to the spread?
So we're all for, if you're at home, we get it. Staying at home is a long process if you have to be in your house, for 4 or 5 days straight. Going out and walking is fine. You just need to, social distance is huge. So you need to stay 3 to 6 feet away. If you decide to go walking, you can't call up, all your friends and all their kids and everybody else. Like Lisa said, if you're in the store, just if the aisle's too crowded, go to a different aisle. Try to minimize touching as much as you possibly can. Use wipes. Use a glove or a rag or something when you pick up the nozzle. It's all about your own safety. You got to be your own advocate. So you just have to make sure that you're not touching things. It's not business as normal. And that's what we just got to kind of remember. But by all means, go out and walk the trails or, walk the sidewalks and stuff. Just don't do it as a group. That's all. I mean, we got to kind of police ourselves a little bit. The longer we don't do what we're asked to do, the longer this is going to go on. So we just kind of want this thing to go away. So if we all just buckle down and do what we're told for the next couple, 14 days or so, we should beat this up pretty good before it gets a hold of us.
A very good point. Thank you for that. If anyone has any questions at home or wants to submit a question to any one of the members of the team, please send it in right now to pembrokeinfo@pactv.org. That's pembrokeinfo@pactv.org. A question for the lieutenant. What kind of calls are you seeing regarding, social distancing or crowds, or are you receiving any kinds of calls like that?
We're not getting a lot of them. Basically, we are noticing that because school's out, there's kids gathering. We see a bunch of vehicles driving around, and that's a cause for concern. I know that the parents probably should be more conscious of that and try to keep that from happening. Again, it's just we can't enforce it. We just give guidance on this.
Understood. Is there anything that can be done in terms of use of basketball courts, walking trails, no contact, social distancing, but as a strong guideline? What is the department more interested in seeing, and what is the department not interested in seeing?
Again, we do notice it. We have conversations. We talk to them and try to make them understand the importance of this. We can't enforce it as far as arresting them. It's criminal. It's a challenge. I mean, this is a learning curve for us also.
Sure. Now, the selectmen have been talking, and they had a meeting yesterday at 3:00, where some questions came up about what the immediate future for some of our elections, some of our town meeting that's scheduled for May 12th, and the local election that's currently scheduled for 16th. There is a lot of discussion back and forth amongst the legislators because all other towns are in that same position. What you're seeing around the South Shore and across the state are folks who are postponing town meetings, pushing local elections. The senator's seat, the election originally scheduled for March 31st, has had that date moved already. So as we go forward through the next days, potentially even today, and through the rest of the week, you're going to start to see, again, quickly arriving directives and new legislation. State Representative Josh Cutler put out a bunch of new information yesterday afternoon, Lisa.
Yes.
Will the team be discussing that today?
Yeah, so what happens is every time a piece of information comes out, and just one thing I want to address with the public, a lot of people believe that somehow we are being informed in advance of it. I'm actually not being informed of any of these decisions, rulings, or new actions in advance. I'm finding out on the press conference on TV alongside everyone else. So what happens is when this information comes out, there is a little bit of lag time. We have to sit down, we have to digest that information, figure out how it applies to Pembroke. As Lieutenant MacDonald referenced, how do you enforce social distancing? This isn't a law. You can't go throw someone in jail because they didn't social distance. So it's a learning curve for us as far as that goes. And we do have to take that information, process it as best we can, and then see, well, how does that apply to Pembroke? How are we going to go ahead and make this fit with our community? How are we going to make that message as short and sweet as possible so people are getting the message and not getting drowned out by the message, and able to comply and be safe? So all of that new stuff is absolutely going to be discussed to talk about those types of things. And it's not a unilateral decision. We talk about the pros and cons of everything and how we're going to apply it within our group. Then we come out with a consensus, and we go ahead and update our website, and we try to do more talks like this so that message gets out there.
That's an excellent point. Now, as different residents come together and they communicate with each other and back to the government entities, to their business owners and their local community advocacies, what can they do to get through this long haul? This is not going to be a short-term event.
No.
Seeing a lot of quick action being taken and people being very serious about this is absolutely an asset. But question for the deputy chief: in the days to come, as this stretches forward, what is the smartest practice to get through all the way through this situation?
Like I said before, so we're accustomed to fighting our wars face to face. This is a hide and seek type of war, and that's kind of what it is. They want you to hide from this. That's the best course of action. I'm not accustomed to, and nor is most people, staying home for 14 days, put your feet up, watching TV. But unfortunately, that's the only way we're going to win this. The more interaction that we have as groups in the public, the worse we're going to be. So you just have to heed the warnings. We have to police ourselves. Like the lieutenant said, there is no criminal arrest for being 2.5 feet from someone, but you're not supposed to be 2.5 feet from someone. So just stay 3 to 6 feet away. And the more we do that, the shorter this is going to be the duration, and people can go back to the way things were. And so it's kind of a hide and seek war. This is one of those wars, as they said, we're not accustomed to it, that we're going to have to hide from.
Sabrina, I have a couple of questions.
Thank you, Julie. I was just about to ask, how's it going out there?
Okay,
Any
so a couple of questions. The first one is regarding testing in Pembroke. People who have been tested positive, you have to, the right of others to know versus their privacy rights. I assume, Lisa, you might be able to answer this because it's a question
Sure.
that's coming in for all of our towns.
Yeah, it is coming across the Commonwealth, and it is touched on literally every single time DPH has a call that is being touched on. And so here's what you have the right to know. Honestly, because of HIPAA, you really don't have the right to know anything. So what we are doing is we're not trying to hide that information from anybody. So we are letting out the number of cases we have, which does stand at 2 right now. We do expect that to change. But that's what you have the right to know. And that's all that you have the right to know, according to the law. So there's no right to know where people have been, what's their health like. There's no right to know what are they doing. I can tell you that every case, without exception, that I have had any firsthand knowledge of across the Commonwealth, everyone is quarantined. No one is being disregarding of that message or that information, so that all the people that are testing positive that I have any personal knowledge of are all staying at home, strictly quarantined as they should be.
Follow up on that, Lisa. If somebody finds out that either they have it or a family member has it, can they self-identify and say, this is where I've been, or this is where I've worked, or this is where I've been recently? Do they have the right to do that?
If a patient volunteers that information, that's completely different. The only word of caution I would give is it gives almost a false sense of security, and I'm gonna explain that thought. People seem to be under the belief of if they know someone has COVID and they know where that person has been, that somehow if they just avoid those places or avoid that person, that they are safe. And the thing I can't stress enough is we will never know the total number of positive cases, because there are dozens of people walking around completely asymptomatic that are positive for COVID, and we will never know about it. There's people walking around that might be experiencing mild symptoms, but their symptoms are mild, so they aren't seeking medical attention, and they will never be tested. So I think part of the desire to know where every positive person is so you can avoid it is a very false misnomer. Assume everyone is positive. Assume everywhere you go, someone positive has been, because statistically, it's probably true.
Okay, and one more follow-up on that is in the press briefings that happen from the president every night and his task force, a couple of the doctors have talked about tests you can take to see if you have the antibodies for this virus. In other words, I might have had this 3 weeks ago, mild condition, I had a cough, I had a cold, I got over it, and now I'm immune to this virus. I think a lot of people think if we had more knowledge about who is actually walking around immune to the virus, that would be a positive. Do you have anything to say to that, or do you need more information?
I would need a little more information, but the same thing is I would say to the testing, there aren't enough tests. There are not enough tests out there. There's not enough people being tested. If we don't have enough COVID tests to test the people that are symptomatic, where are all these tests going to come up for the antibodies, and who's going to do the work? Our hospitals are keeping up now, but who's going to start doing all this testing for antibodies? From a medical standpoint, it's always great to have more data. And if we had more data, we would know more. But this is still an emerging infectious disease. We are still learning about it. And we're just simply, as a country, as a medical profession, and from every demographic you can look at this, we just do not have the ability to get enough of that information put together to know that much. So on one hand, yes, Julie, having all that information would be so awesome. I just don't see how that could possibly be executed and how it can be executed enough to give us the kind of data we need. Unfortunately, like a lot of emerging infectious diseases, by the time we get there, the party's kind of over. But I hope that's not the case. I hope that testing and the testing for antibodies and all of that can be ramped up to the point where it can actually be useful in the response.
Okay, and one more question that I have, and it's from the social media that we've seen a lot, is a lot of people have stepped up and they're making masks, and they're contributing things to the police department or the EMS or the people that are delivering Meals on Wheels. Is there a certain protocol that people should follow if they want to help? They want to help by making something to help our first responders. What are the guidelines that they can use?
Sure. There's at least 24 different instruction tutorials on making different things floating around the internet, everything from hand sanitizer to masks. The only word of caution I'll give people, because I hate to see well-meaning people ever get their feelings hurt. Please understand, no mask that we can handcraft is going to perform the work of an N95 or an N100 mask. However, as supplies run short, is it better to have a handcrafted mask than no mask? Of course it is. Is it a great safeguard for someone saying delivering Meals on Wheels or something like that to have a handmade mask versus no mask? Of course, that's a wonderful thing. It's a wonderful tool for them to have. I just don't want people to ever be hurt if for some reason a hospital or someone says, I can't really use this item because it doesn't meet the standards that we need to be at. But again, as those supplies run short, again, something is always better than nothing.
Okay, back to you, Sabrina.
Thank you. So, Lisa, the town
Yes.
manager in the town of Pembroke has just volunteered to drive and deliver Meals on Wheels.
Yes, he has.
What are the other things people can do to volunteer in a safe way and be a part of fixing a problem or helping the community? I know sitting home has caused some calls to come in and some concerns that people just need more things and more outlets, but they shouldn't always be outside. What are some of those opportunities?
Sure. So there's 100 different skill sets. And if people aren't already on YouTube or Zoom, here we are Zooming, my first time Zooming. I hope I Zoom well. But if you have skills that you can share, like I think most people, and I apologize in advance all to the nice public, are probably sick of hearing my voice, but I'm not doing this to hear myself talk. I am going around to all the different media that I can get a hold of to share this message in the hopes that if someone doesn't listen to WATD, maybe they listen to Pembroke Town News. And if they don't listen to Pembroke Town News, maybe they're here on PACTV getting their information. So I'm not doing it out of desire to hear myself talk. I'm doing it out of the desire of I have a certain amount of knowledge and I'm trying to share that knowledge with as many people as possible. So sitting at home, there's teachers sitting at home. Maybe you have a favorite class. Maybe you have a nature hike and you can take out your smartphone and go on a nature hike and talk about the different flora and fauna you see. And you can upload that. And there's a free nature hike tutorial online for moms at home with 20 gazillion kids tearing the house apart and say, hey, listen, teacher so-and-so is out in the woods doing a tutorial. Let's watch it. Maybe you're a math teacher, science teacher. Maybe you're not even a teacher. Maybe you're just someone that's spent a lifetime career at something that maybe someone else wants to learn about. And creating a little video is one, fun for you. It's time consuming. Make a video, make something interesting to watch and go out there and watch it and share it with others. Maybe you are the person that is really crafty at sewing and you can sew up some wonderful items and be able to share those with others. Maybe you're someone that loves to cook and you never have time to cook, and you can make incredible handmade pasta and things like that. So maybe you're going to make some dishes and share it with seniors that might be near you that are not getting as quality a home cooked meal as you can. Of course, you should always reach out in advance and make sure people actually, don't have a dietary restriction. But, a handmade meal might be something really luxurious to a couple that's trapped at home, and that's a way you can share your skills. So those are just some ideas right off the top of my head, but we all have skills, and if you have a skill, maybe your skill is technology, and maybe you can teach a couple other people how to use that technology, so that they're not so isolated, and that's a wonderful skill to share too.
That's a really, really good point. And some of our Pembroke friends have these very robust social media presences where they come together and post questions and concerns. And now, to your point, is a great time for them to gather up some of these videos. I know someone close in my life who has to find ways to work out without having access to a gym or a public facility where all of those weights and things are available. So they're starting to share this community, this gym fitness.
A lot of that. And they're on there doing all those videos, and it's awesome. And I've seen at least a half a dozen. Like I said, CrossFit Magnitude. He was all crushed that he wasn't going to be able to have people in his gym, but he's developed a whole online thing that you can go on there and watch and work out with them. But there's any physical trainer, any gym teacher, anyone that has some of those skills, get those kids out, get them standing up. But not only that, the moms and the dads, if nothing else, go for a nice walk. But if you're looking for that workout, throw that stuff up there, share your skills.
No, that's excellent. Now, Lieutenant, I have a question about protocols at the department. The police department right now is trying to observe social distancing, and the lobby is a very small space. What do you have for the folks at home regarding how they can bring forward some of their needs?
So what we're trying to do is, basically, if you can call the police station for whatever needs you have, to do that first. The idea of coming to the station is not a good one because, like you said, it's a small area. Sometimes people just have to do that. So we're trying to minimize that. Going to houses, if we can handle the call over the phone, we'd like to do that also. Call first, let us filter that.
And what phone number would people be calling, Lieutenant?
It'd be 781-293-6363.
Thank you. Thank you very much. So, Lisa, back to you for a quick second.
Mm-hmm.
You have all these folks, and they're doing their best, and they want their daily updates.
Mm-hmm.
The website page, with its, again, so many stakeholders came together to create it.
Yep.
Is there any way that people can have input in terms of what they see on that page, or what kinds of things the emergency management team should be promoting at this very early stage?
Sure, of course. They can always drop us a voicemail here at the Board of Health. Obviously, we are short-staffed. Obviously, we are not all sitting in the same room, but I am checking messages daily. So if someone has a specific concern, they want to leave us a voicemail, 781-293-2718. Certainly also on that Pembroke page, you can click over to Board of Health, and there's a hyperlink right to my email. I can give it out, but it's 20 gazillion pages long. But that hyperlink's right there. Click on the hyperlink. It will send a message right to me. Again, I'm checking that minimum of once a day, despite everything else going on. I cannot promise an answer to each and every person individually, but the information that's coming in that way is influencing the message out there to social media and our own webpage for the town of Pembroke. We're going ahead and using that information and dialogue we're getting in to shape that message. And if there's areas of information we're missing that people are needing, we're using that information coming in to update that page.
Sabrina?
No, thank you. Very good information.
Excuse me,
Julie?
Sabrina, I got another question.
Sure, please.
Hi. Okay, so the question is about people that are delivering food delivery services. Is there any protocol, and this probably involves both the police and the fire, also for drivers that are doing this? Do they have to have any kind of gloves? Is there any protocol that people should use if they're getting food delivered to their home from restaurants, from takeouts?
So food delivery doesn't have a specific protocol. Again, we're a little bit in uncharted waters for a time like this. But people have to remember food service establishments have been dealing with communicable disease long before COVID-19, and their food handling practices and their single-use bags and their single-use containers that they are distributing that food in, the people handling it are already using the kinds of precautions not to pass along COVID. However, when you talk about drivers, the good news is they're being handed sealed containers and hopefully bags that are somewhat contained, hopefully with handles. And the idyllic situation would be for people to pay by credit card over the phone, so there's no need to exchange money or to swipe a card at delivery. If at all possible, please pay over the phone. If you must exchange money, obviously try to minimize any kind of contact, keep your social distancing if it's possible. So if I were a food driver today, the kinds of things I would think about, I would be thinking about wearing gloves. I would think about changing those gloves often. I would be washing my hands. I'm going to say this 100 times, washing my hands every time I'm back at my restaurant or base location. I'm going to be washing my hands before I take out the next round of deliveries. And for the people getting the deliveries, it's always good. Maybe you don't hand off the bag hand to hand, but someone puts it on a doorstep, rings a bell, and steps away from the door, and then you take that bag in. Certainly those drivers, if someone was concerned and wanted to wear a mask, I don't think that's a bad idea either. There's another thing, though, that I'm going to kind of bounce this to Lieutenant MacDonald. I heard a very disturbing trend, which is, again, why I think people should be paying over the phone, where unfortunately people are looking to ambush delivery drivers. Just another reason why I think that payments over the phone are optimal. MacDonald, are you hearing any about that? Because I heard that a couple times. It was a little scary.
Lieutenant MacDonald, you are muted. Thank you. Thank you, sir.
Am I back on?
You
Yeah,
are.
there we go.
Thank you.
Yeah, that's not a problem here locally, but it is happening. And ideally, those are precautions that the people that are doing these delivery have to face. It's unfortunate. Mostly it's happening in urban areas. At the end of the day, it's been happening before this has impacted us as far as the disease, but you just have to be conscious of it.
So, Lisa, as far as pickup food, you've got folks who, restaurant owners who are still preparing their meals, but instead of having folks can dine in, they're
Yep.
packaging them and
Yep.
putting them in bags.
Yep.
And they are also transferring them using similar methods. Is that correct?
Yes, actually, I used a couple of our local establishments. My husband picked me up a fantastic meal the other day at the Meadowbrook. I also picked up another fantastic meal out of Dishes Tavern. So I'll speak to those two because I personally have experience. But it was awesome. We ordered our meal. We went ahead and had them bundle it all up. We paid over the phone. We did even gratuities over the phone. And when you went to get your bag, there was no huddling around in either establishment. You could just call and someone would bring it out to you. Again, one point of contact, grab your bag and go. Or you could walk in and take your bag and go. So there was virtually no human-to-human contact other than to pass a bag, which is really maximizing the distance between people and the points of contact, which is great. So,
Lisa, can you talk to the grab and go process at the Pembroke Food Pantry?
yeah, so when this started to become more problematic and more obvious, I talked with the directors of the pantry and I said, you guys have a really small space and you're going to have to think about that. They're like, yeah, we know, we kind of have thought about this issue. And I said, is there an opportunity, not unlike the schools, to do grab and go? I realized for the people that utilize the pantry services, that's not optimal. People like to kind of go in there and shop for the food they want. But unfortunately, in these times, it's just not safe. These pantries are extremely small. There's a lot of people that work in them, never mind the people that visit them. So the pantry is not large enough for shopping internally and doing social distancing. So what they've done instead is start doing grab and go bags and 2 to 3 bags per family. They're all set up. They're brought outside, which is awesome. Great airflow, maximum space between people. And families just drive up, they pick up their couple of bags and they drive away. So again, minimal points of contact, minimal opportunity for people to pass along things from one to another, which is optimal.
Excellent. Now, as we get close to wrapping up, which won't be for another 5 minutes or so, this is an opportunity to sort of express to everyone who may be watching, what are some of the biggest concerns that you have And what are some of the best things you'd like to have as takeaways from this event, starting with Deputy Chief McCormick?
So the biggest concern that we have at the firehouse, so it's still kind of business as usual at the firehouse. Our runs are about the same. We haven't had an influx of flu type calls yet. Our biggest concern is when we hit that curve and we start getting those calls, that if you need to make sure that before we bring you to the hospital that you've called your PCP, walk through the steps to make sure it's either the flu or it's not the flu, and just not try to inundate the fire department ambulance service so that we end up inundating the hospitals. That's our biggest thing. Right now, everything that we're doing is the prevention of trying to put more people in the hospital. So we're asking people to call their PCP. We're asking people to wait till they have actual symptoms, which is a CDC guideline, and not just call the minute you have a tickle in your throat. Try to figure that out. And if you believe that you have an issue, to isolate yourself, to quarantine yourself in your house for a little bit. If there are any issues, the breathing or anything, call us. We'll be more than happy to come. We'll take you to the hospital. We just don't want that influx when we get the first 5 or 6 cases in the town, where everybody's coughing. That's our biggest concern. Other than that, we're doing well over there. We've implemented a few different guidelines on the ambulance. No more family or friends unless it's a minor or a staff member that needs to go with a patient, which is not normal for us, which is a change. Where the shift commanders are using their discretion on PPE. The police department through EMD is doing a great job with asking the CDC protocol questions for COVID-19. So that's our biggest issue. Our biggest issue is not to get inundated.
Very good. Thank you for that. As far as public safety incoming calls, Lieutenant MacDonald, what are some of the things that you would like to see as takeaways to residents at home? And what message would you give them if you could say one thing to every person right now?
Well, first of all, if you don't need us, if it's not important, please wait. There are other needs that we need to prioritize. The big picture is that, like the deputy said, is let us know if we have to go to your house for some reason, if any of these protocol questions are happening. It doesn't need to be a medical call. A lot of times we go there for somebody that just fell down, and then we found out after the fact that they had flu-like symptoms, and we didn't know that. So these first responders that go there like to have that knowledge for pre-arrival instruction in order to don their PPEs to be ready for that.
Very good. Now, just as a follow-up to everyone at home, the next forum for the emergency management group will be held on Tuesday at 9 a.m. At that point in time, there's discussion about inviting the superintendent of schools to participate in this, as there's new information on school closures. And additional folks could include some of your chiefs from the departments, although quite frankly, today was fantastic. And potentially even Board of Health chairmen, selectmen, people to come on and flush out this very long duration, potentially, situation while we're still in quiet days. But to finish up today, Lisa,
Yes.
health agent, what would you hope takeaways from this first engagement are? And what would you say to the public now that you have the platform? Go ahead.
Wash your hands. That's always my message. Wash your hands often, wash your hands after handling anything. The other thing that concerns me, and it seems to be fading away, which I'm very grateful for, is people that think it was a hoax or fake or it won't happen to them. If people are not watching the news, understand we are seeing fatalities in people much younger than just the senior category. Obviously, it's still more serious for them. Obviously, it's still more dangerous for people with underlying conditions, but we are seeing fatalities in otherwise young, healthy people. And I'm beginning to see that message hit home for the general population, that people realize now this could happen to me. And some people are just having a really adverse reaction to this virus and having a very poor outcome afterwards. So I'm appreciative that people seem to be taking this more seriously. To those of you sitting at home that think this won't happen to me or I'll be fine, please don't take that attitude. Even if you are fine, your spouse might be fine, your children might not be fine, your parents might not be fine. So do take it seriously. Do follow these guidelines. No one, myself included, wants to see these guidelines become even more stricter or longer. And for those that aren't taking this seriously, you're making it longer for all the rest of us. So I would just ask everyone to take this seriously, be calm, and wash your hands.
Thank you, Lisa. Thank you, everyone. I know you have a very important meeting in the next 15 minutes and need to wrap up and prepare. But is there any last words from anyone?
I do.
Be safe.
Yeah,
I
be
do.
safe. The town of Pembroke's doing a great job, so just keep doing what we're doing.
Thank you very much. Last moment, selectmen's meetings have been moved to Tuesdays at 3:00 on this channel. You can tune right in. They will be coordinating very closely with emergency management, as they have been doing all along. Town manager has acted as interface between the two groups. Selectmen will be conveying latest news on town meetings, potential legislation that will go through, changes to any election cycles, any government questions that you would like answered. And I want to thank everybody today and ask Julie if we are all set to wrap up. Are we good?
Thank you so much, Sabrina, and thank you all for joining the Pembroke Emergency Management Group. Like Sabrina said, there will be other people that will be on future forums. We do have a lot of religious leaders, we have church services, we have psychologists, we have all kinds of people who also want to get their message out. So maybe on future episodes we could bring some of them in. We do at PACTV also run a lot of religious services on Sundays on our public channel, which is Comcast 13 there in Pembroke. So please make sure you can tune into those, because obviously we can't go to church. So again, this has been the Pembroke COVID-19 update, which will be done every Tuesday and Thursday at 9 a.m. Please do visit the Pembroke website, and I'm going to throw it up on the screen right now so you can see it. The Pembroke website is wonderful because it has everything and it's updated daily. And this red banner right here, click on that and it will be like, this says Wednesday, this will be updated for Thursday. So scroll through it. Probably all the questions you really need to have answered are right here. So this is kind of a one-stop shopping. Again, back to us. Anytime we have a forum, email pembrokeinfo@pactv.org, and anyone who's on the forum will be able to answer those questions. Again, visit pactv.org for replay times. We're here to help everyone get through this. We'd love to hear all your positive things, all your silver linings that come out of this, because it's really important that we all stay positive, we stay together, we stay healthy, and wash your hands. For PACTV, I'm Julie Thompson. Thank you.